Welcome to the Department of Human Services webinar series, Strengthening Iowa's Child Care System. The series outlines the changes to Iowa's child care system based on a federal law that was updated to include new requirements. This particular webinar is designed to cover the changes for non-registered child care homes that have a Child Care Assistance Provider Agreement, but not registered as a child development home with the state of Iowa. We will cover three main topics: background research on why these changes are important, information about the reauthorized federal law, and specific rule changes that will be happening for child care providers. Additionally, there will be changes to the Child Care Assistance Program, which will also affect child care providers. There's a separate webinar that discusses these changes titled Changes to the Child Care Assistance Program. Please watch the webinar to learn about these important changes. Childcare is often the silent service in communities that allows parents to work or go to school. In the last 10 years, there's been considerable conversation and action related to preschool. However, the importance of quality childcare is also gaining more traction on the federal level, as well as in conversations in our state. For more than 10 years, neuroscience research in the area of brain development has identified the importance of the first few years of life. You, as a child care provider, play a critical role in helping build children's brains by providing a safe, caring, nurturing, and engaging early learning environment. You likely already know this, but I want to recognize your role in building better brains in young children. To put it all in perspective, Iowa ranks number 1 among all 50 states, with 76% of households with children under age 6 having all available parents in the household in the labor force. The national average is 65%. Many of those children are cared for in home child care settings. During the first 2 years of life, way before a child steps foot in a school setting, 700 new brain synapses happen per second. The synapses connect the neurons in the brain. Since brains are built in stages with more complex structures built on simpler structures, it is extremely important to build a strong foundation in the early years. Take a moment to think about the children you are caring for. What is the average amount of time a child is in your care? 6 hours? 8 hours? 10 hours? If we think about the 700 new synapses that happen per second in the first 2 years of life, if a parent drops their child off with you at 8 a.m. and picks the child up at 5:30 p.m., that child's brain has changed in almost 24 million ways during that time period. Caring and nurturing early learning environments help young children develop social and emotional skills. These are skills like communication, problem solving, creativity, emotional control, critical thinking, teamwork, and ethics. In the workforce, these skills are referred to as soft skills or people skills, and employers are looking for employees with these skills. Childcare is also important to your local community and our state economy. Parents need childcare to be able to work or go to school, and employers need employees to be able to locate a business in a community. Now let's take a quick look at how we got to where we are today and the changes we are preparing for. On the federal level, Congress reauthorized, or changed and updated, a law called the Child Care and Development Block Grant. This is the law that gives federal funding to help low-income families pay for child care and to improve the quality of child care for all children. The law was originally written almost 20 years ago, and much has been learned about child development since that time. The changes in the reauthorization represent a paradigm shift for child care in our state. The previous version of the law viewed child care as mainly a work support for parents to participate in the workforce and gain economic stability. In the reauthorized version of the law, the purpose of the fund was expanded to recognize and include child care's role in promoting healthy development of children in high-quality child care programs. Iowa uses the money we receive from this law for the Child Care Assistance Program, DHS regulatory staff that do monitoring visits with child care providers, and for quality improvement activities for child care providers, such as Child Care Resource and Referral, Iowa State University Environmental Rating Scale reviews, Quality Rating System bonuses, and Child Care Wraparound grants. As part of the law, Iowa submitted a state child care plan. The plan outlines how Iowa will meet all of the federal requirements. The Department of Human Services asked for public comment on the plan over many months, and the plan was submitted to the federal government on March 1, 2016. You can find a copy of the state plan that Iowa submitted on the DHS website. If you click on the Providers and Partners tab, there is a heading for childcare. Underneath the childcare heading, there is a link entitled Reauthorization of the Child Care and Development Block Grant. That will take you to the page where you can view a copy of the Iowa Child Care Development Fund state plan. In the rest of this webinar, we will focus on 3 major areas of change that will be significant for non-registered providers that have a CCA agreement. Major areas of change will include the Child Care Assistance Program, health and safety changes, and consumer education. For a more detailed account of the state's plans for all of the changes required by the reauthorized law, please refer to the state plan on the DHS website. Child Care Assistance is the name of the state program that helps eligible low-income families pay for child care while parents are working or participating in education or training. The majority of the funding for this program comes from federal funds. There will be many changes to the Child Care Assistance Program in Iowa based on the new federal law. These changes include moving from 6-month to 12-month eligibility periods, allowing for temporary changes in work, training, or education activities, allowing for a longer job search activities during the 12-month certification, a new exit eligibility program, and changes to reimbursement rates for some child care providers. The webinar called Changes to the Child Care Assistance Program provides more information on these changes. Another area of change will be health and safety regulations. There will be changes to the Iowa administrative rules for child care programs as the federal law puts the health and safety of children as a high priority. The majority of these changes will take effect on October 1, 2016. Let's take a little bit of time to review some of the most significant proposed changes, keeping in mind that this is an overview. DHS will share more detailed information about the administrative rule changes in the coming months once the rules are finalized. The new law requires DHS to conduct an annual unannounced monitoring visit to child care homes with a CCA Provider Agreement. These monitoring visits will be based on minimum health and safety guidelines. The department has proposed new administrative rules to help give more clarification and guidance on this subject. Many of the minimum health and safety guidelines in the proposed rules can be found in the current COM 95. That's already given to child care homes that have a Child Care Assistance Provider Agreement. Communications will be sent to providers once the Iowa administrative rules are finalized.